Hello friends, welcome to Physiology Matters. In this video, we will quickly revise cardiac output. This cardiac output is one of the most important topic in cardiovascular physiology. LAQ, BAQ or SAQ can be asked on this topic. First we will see definitions. The first one is cardiac output. So this cardiac output is the amount of blood pumped from each ventricle in 1 minute. It is called as the cardiac output. So the amount of blood pumped from left ventricle into the aorta in 1 minute, it is the cardiac output. Okay, and it is same for left ventricle and right ventricle. So right ventricle also pumps equal amount of the blood in pulmonary artery in 1 minute. So cardiac output for left and right ventricle is same. So formula for this cardiac output is heart rate into the stroke volume. So stroke volume, it is the amount of blood pumped by left ventricle into the aorta in one heartbeat. And heart rate, it is the number of beats per minute. So in one heartbeat, how much amount of the blood is pumped you will get by stroke volume, and number of beats in 1 minute you will get by heart rate. So if we will multiply heart rate with the stroke volume, you will get the cardiac output. Now normal values for this cardiac output range is 5 to 6 liter per minute. Next one is stroke volume. So it is the amount of blood pumped by the left ventricle in one heartbeat. So it is around 70 to 80 ml per beat. So in one beat, this left ventricle, how much blood it pumps into the aorta, okay, in one heartbeat, that is the stroke volume. So normal value is 70 to 80 ml per beat. Then venous return, it is the amount of blood coming from veins into the right atrium in 1 minute. Okay, so this is superior vena cava, okay, and this is inferior vena cava. So they will pour blood into the right atrium and it will pour blood into the right ventricle. So amount of blood coming from the veins, that is superior vena cava and inferior vena cava in right atrium, okay, in 1 minute. In normal conditions, this venous return is same as that of the cardiac output. So whatever the amount of blood which is coming in right atrium in 1 minute, same amount of blood will be pumped by the left ventricle into the aorta in 1 minute. Okay, so cardiac output and venous return, they are same in normal condition. So that's why the venous return normal values are 5 to 6 liter per minute. Now end systolic volume. So as the name suggested, it is the volume of blood or amount of blood which remains in the ventricles at the end of the systole. Okay, so the amount of blood remain in the ventricle at the end of the systole. So when there is a contraction phase and this contraction phase is ending, so that is the rapid ejection phase and slow ejection phase. So at the end of this slow ejection phase, okay, so there is contraction of the ventricles. Okay, so at this phase the amount of blood which remains in the ventricle, it is called as end systolic volume. So it is called as, the normal value is 50 ml. Okay, then end diastolic volume. So it is the volume of blood or amount of blood which remains in the ventricle at the end of the diastole. So diastole, that is the relaxation phase, and the last phase is the last rapid filling phase. Okay, so during this phase the amount of blood which remains in the left ventricle Okay, so the amount of blood which is there in the ventricle at the end of the diastole, it is the end diastolic volume, and this end diastolic volume is nothing but the preload, that is the load, it equals to the preload. We will see this also. So preload, that is the load acting on a cardiac muscle before muscle starts contraction. Okay, so normal value here for the end diastolic volume is 110 to 120 ml. Ejection fraction, so this is the amount or a fraction, that is the percentage. So the fraction or percentage of the end diastolic volume ejected from the ventricle. So suppose 100% of the blood, okay, which is there present, it is 100%. So out of this 100%, 60% of the blood, it is ejected from the left ventricle into the aorta. So ejection fraction here will become 60%. Okay, so ejection fraction is the amount of, or the not amount, it is the fraction or percentage of the end diastolic volume ejected from the ventricle. Okay, so normal value is 60%. Then cardiac index, this is the cardiac output per square meter of the body surface area. So here body surface area is this parameter is involved, and its normal value is 3 liter per minute per meter square of the body surface area. Now we will see physiological variations in cardiac output. So the first variation, it is the age. So in younger age groups, this cardiac output is more, and in older age groups, this cardiac output is less. So why this is less in older age groups? The reason is decrease in the stroke volume and decrease in the heart rate. So we had seen the formula for the cardiac output, it is equal to heart rate into the stroke volume. So whatever factors which are increasing heart rate, stroke volume, or both, it will increase the cardiac output, and the factors which will decrease heart rate, decrease stroke volume, or both, it will decrease the cardiac output. So age, younger age group, there is more cardiac output as compared to the older one. Now gender, that is the sex of a person. So in male it is higher, in male it is around 5.6 liter per minute, and in females it is on an average 4.9 liter per minute. So it is more in males. Then posture, this cardiac output is more in lying down position than standing. So what happens in standing position? There is pulling of blood, pulling of blood. So what will happen? It will decrease the venous return, it will decrease the stroke volume, it will decrease the stroke volume, thus it will decrease the cardiac output. So in standing, cardiac output is less, and in lying down position, cardiac output is more. Now muscular exercise, it will increase heart rate as well as stroke volume. Okay, so that's why there will be increase in the cardiac output. Catecholamines, they will increase heart rate, so that's why there will be increase in the cardiac output. And in pregnancy, there is increase in the volume of blood, so it will increase the cardiac output. Okay, so these are important physiological variations. Then which are pathological variations, okay, for cardiac output? So there will be increase in the cardiac output in case of the fever, hyperthyroidism, anemia, and decrease in the cardiac output in congestive cardiac failure, cardiac shock, arrhythmia, and heart block. In fever, there will be increase in the oxidative process, that is the oxidation. Increase in oxidation, it will increase the cardiac output. Then in hyperthyroidism, there will be increase in the metabolism. Okay, in anemia, there will be hypoxia, and this hypoxia will increase the cardiac output. Now decreasing cardiac output, congestive cardiac failure. Here there will be weak contractions. Okay, so due to these weak contraction, there will be this congestive cardiac failure. Then cardiac shock, it will be due to the poor pumping. So due to poor pumping in cardiac shock, the cardiac output will decrease. In arrhythmia, there will be incomplete filling. In arrhythmias, so there will be decrease in the cardiac output, and in heart block there will be defective pumping. So as there is heart block, so defective pumping, it will result in decrease in the cardiac output. Okay, so these are the important pathological conditions where you will get variation in the cardiac output. Now factors affecting cardiac output. So as formula for the cardiac output is heart rate multiply with the stroke volume. Okay, so whatever the factors they are affecting heart rate will affect the cardiac output, and factors which are affecting stroke volume, they will also affect the cardiac output. First we will see factors affecting heart rate. So the first one is the respiration. In the respiration there is inspiration and expiration. In inspiration the heart rate will increase, there will be increase in the heart rate, so cardiac output will increase, and in expiration the heart rate will decrease, so cardiac output will decrease. So it is proportional there. Okay, in inspiration heart rate increase, cardiac output increase, expiration heart rate decrease, cardiac output will decrease. Then impulses from the higher center. So these higher centers are generally hypothalamus and the limbic system. Okay, here heart rate is increased in response to the excitement, anger, so thus cardiac output will increase, and heart rate will decrease in case of the fear, grief, so cardiac output will decrease. Then the next one is arterial baroreceptors. Now here if there will be decrease in the activity of baroreceptor, the heart rate will increase, that is there will be increase in the heart rate, increase in the cardiac output, and if there will be increase in the activity, heart rate will decrease and decrease in the cardiac output. So there is inverse relationship. So decrease in the activity will increase heart rate, increase cardiac output, increase in the activity will decrease heart rate and decrease cardiac output. Then the next one is hypoxia. So this hypoxia, there will be increase in the heart rate and thus increase in the cardiac output. And this carbon dioxide, CO2, in excess, if there is this CO2, it will increase the heart rate and thus it will increase the cardiac output. Okay, then pain, most of the painful condition will increase the heart rate and thus they will increase the cardiac output. Then intracranial pressure, so if there is increase in the intracranial pressure, it will decrease the heart rate and thus it will decrease the cardiac output. Then the hormones, here most important hormones are the adrenaline and thyroxine. Both of these hormones will increase the heart rate and thus they will increase the cardiac output. Then this body temperature, if this body temperature, this temperature is increase, there will be increase in the heart rate and there will be increase in the cardiac output. So which are the condition where you will get increase in the body temperature? So they are fever, hyperthyroidism, exercise, etc. Okay, so these are some of the condition where you will get increase in the body temperature. Then the next factors are factors affecting stroke volume. Okay, now this stroke volume, it mainly depends on the ventricular filling. It mainly depends on the ventricular filling. Okay, thus it will depend on the uh, venous return, that is the preload. So it will depend on the preload. Okay, so which are the factors increasing ventricular filling? So they are total circulatory blood volume, then efficiency of cardiac muscle and skeletal muscle pumping. If they are more efficient, there will be more stroke volume and the cardiac output will be more. Venous tone, more the venous tone, more will be the stroke volume, more will be the preload, more will be the stroke volume, and more will be the cardiac output. Intrathoracic pressure, so this will be more in case of the in condition of inspiration. In inspiration, this intrathoracic pressure will be more and the cardiac output will be more. Okay, so these are some of the important factors affecting cardiac output. Factors affecting heart rate and stroke volume, they will affect the cardiac output. Now cardiac output regulation or control. Here three important factors are preload, afterload, and cardiac contractility. Okay, what is preload? It is the load or pressure which is acting on a muscle before it starts contraction. What is afterload? It is load which is acting on a muscle after muscle starts contraction. So here preload, see, this is the superior vena cava and inferior vena cava. Okay, and superior vena cava, it will, and inferior vena cava, they will pour blood in the right atrium and it will pour blood into the right ventricle. Okay, so here this preload. Okay, so this venous return, okay, this venous return, it will be the same as the cardiac output. In this preload, most important thing we have to learn is the Frank-Starling's law. What is this law? It states that the force of contraction of cardiac muscle is proportionate to the initial length of the muscle fiber within physiological limits. So in heart, end diastolic volume, it is the preload. Okay, so this end diastolic volume is decided by again venous return. So we had seen end diastolic volume, it is the amount of blood remain in the which is there in the ventricle at the end of the diastole. Now this blood which is there at the end of the diastole, it will exert pressure on the ventricular muscles. Okay, so it is already exerting pressure, and after the end of the diastole there is starting of the systole, that is the contraction. So this end diastolic volume, it is exerting pressure on the cardiac muscle before they will contract. So that's why this end diastolic volume, it becomes the preload and it is determined by venous return. Okay, so that's why this venous return is important for end diastolic volume, and this end diastolic volume is nothing but the preload. So if there is increase in venous return, there will be increase in the end diastolic volume, so there will be increase in the stroke volume, so cardiac output will increase. If there will be decrease in the venous return, there will be decrease in the end diastolic volume and decrease in the stroke volume, so cardiac output will decrease. So they are directly related. So there is a direct relationship of cardiac output with the venous return, but within physiological limits. Okay, so the next one is afterload. Now this afterload, in afterload, peripheral resistance is important. Peripheral resistance. So this left ventricle, it is pumping blood into the aorta against peripheral resistance. What is this peripheral resistance? It is the resistance offered by the peripheral arteries. By the peripheral arteries. So peripheral resistance, peripheral arteries. So it is important for afterload condition. So if there is increase in the peripheral resistance, there will be decrease in the cardiac output, and if there will be decrease in the peripheral resistance, increase in the cardiac output. Let's see this. If there will be increase in the peripheral resistance, there will be decrease in the cardiac output, and if there will be decrease in the peripheral resistance, there will be increase in the cardiac output. So inverse relationship is there. Then the cardiac contractility. Okay, so this cardiac contractility, that is the myocardial contractility, it mainly depends on the force and frequency of myocardial contraction. So if there will be increase in the myocardial contractility, there will be increase in the stroke volume, there will be increase in the cardiac output. So there is direct relationship. Okay, so this is about the control mechanism or the regulation of the cardiac output. Important, most important factors. Now methods of measurement of cardiac output. In animals, in animal experiments, electromagnetic or ultrasound flow meter is used. This is the method which we use for the measurement of cardiac output in animals. Electromagnetic or ultrasound flow meter. Okay. Then for humans, dye method is used, where dye dilution method, where Evans blue dye can be used. Now in dye method, the formula used for the cardiac output is the amount of dye injected in milligram. So here CO equal to amount of dye injected, okay, injected into 60 divided by average concentration of dye, that is the concentration of dye in each ml, multiply with the duration of the curve, duration of the curve in seconds. Okay, this formula is used for dye method. Then next one is the fixed principle. Okay, so this fixed principle is used for measurement of the cardiac output by indirect method. Okay, here in this method cardiac output is obtained. So in this method cardiac output formula used is cardiac output equal to oxygen absorbed by the lungs per minute divided by arteriovenous oxygen difference. This formula is used for calculation of the cardiac output. Cardiac output's unit is ml per minute. Okay, this is by fixed principle. Here body oxygen consumption, these are calculated, then mixed venous oxygen concentration and arterial oxygen concentration are calculated in this method. The next one is the ballistocardiography method. This is a physical method. Then thermodilution method, this is based on the indicator dilution principle, and nowadays most preferred method is the echocardiography. Okay, here this method it uses the Doppler echo, it uses Doppler echo, and by measuring the cross sectional area and velocity of the blood flow. So nowadays recommended method or the most the method which is mostly preferred, it is the echocardiography method. Okay, so this is about the methods used for measurement of the cardiac output. Then some of the high output cardiac failure conditions and low output cardiac failure conditions. Okay, so high output cardiac failure conditions are beriberi, arteriovenous fistula, severe anemia and hyperthyroidism. Now in all these conditions In all these conditions there is low peripheral resistance. So peripheral resistance is low. So due to low peripheral resistance there is increase in the cardiac output, and these are all cardiac failure conditions where you will get high cardiac output. And in low cardiac output failure conditions, they are the congestive cardiac failure, coronary artery disease, and myocarditis. So these are the most important diseases where you will get low cardiac output cardiac failure condition, that is the congestive cardiac failure, coronary artery disease, and myocarditis. Okay, so this is all about the cardiac output. Okay, so I have prepared this video for quick revision of this cardiac output topic. Okay, so you can take notes of these topics and you can add your own points also there. Okay, and you can get a your LAQ, SAQ, BAQs prepare. Okay, thanks for watching this video, and please subscribe to my channel and keep watching these videos. Thank you.